This is Akashvani. In the program Spotlight, now we bring you a discussion on inauguration of 5 new AIIMS promoting accessibility, affordability and research for health. The participants are Dr. V.K. Paul, member NITI AAYOG, and Sonu Sud, anchor.
Yesterday, Prime Minister Shri Narendra Modi dedicated to the nation 5 All India Institute of Medical Sciences AIIMS at Rajkot in Gujarat, Bhatinda in Punjab, Rai Bareli in Uttar Pradesh, Kalyani in West Bengal, and Mangalgiri in Andhra Pradesh. Recently, the PM also inaugurated new AIIMS at Rewari in Haryana and at Vijaypur in Jammu. To discuss this exciting development for the health sector, we have with us Dr. V.K. Paul, member NITI AAYOG. Dr. Paul, a warm welcome to you on Akashvani.
Thank you and good evening.
So we'd like to know from you, 7 new AIIMS in 10 days. It seems like world record. Can you tell us about the significance AIIMS in the country's health infrastructure, especially tertiary care, where, serious patients often require hospitalization?
It is indeed historic to have 7 apex-level institutions being operationalized and made available to the people of India in less than 10 days. It speaks of the commitment of the government. It speaks of the scale at which our government works. And as you very correctly say, this epitomizes, it reflects the commitment of the government to ensure that the high-end care, high-end facilities, tertiary and tertiary plus facilities are being made available in all parts of the country in a very, very big speed. We should remember that in the 10 years ago, only 7 such institutions apart from New Delhi AIIMS, which has been the original AIIMS, were sanctioned. That's what we had 10 years ago. And in these 10 years, 15 new AIIMS have been sanctioned. And we have seen 7 of them going to the stage of, dedication to the nation and operationalization. It's an amazing journey that has been now completed, and the remaining few institutions which are in the different level of operationalization will also be operationalized in near future.
In fact, sir, earlier only there was one AIIMS in Delhi for the entire country for a long time. Now AIIMS are spread across the country in tier 2, tier 3 towns. This shows the inclusive approach of your government and its vision of every Indian getting easy access to the best healthcare facilities.
There's no doubt. Having the presence of, which is, as I said, apex level medical science institution is creating a pathway for us to reach the high points reflected in our commitment to Viksit Bharat. Because when you establish an AIIMS in a geography, what you are providing is, first and foremost, of course, high-end care, sophisticated high-end care, most advanced care, which will continue to get further and further advanced as the time moves on. And people then do not have to travel long distances, which saves their out-of-pocket expenditure. It becomes practical. It becomes possible for not so well-off poor people to be able to access care. So that's one part. But the second and third part are that these are the institutions which are the hubs of high-quality education of doctors, nurses, and allied health professionals in a very big way. And the AIIMS benchmarks are global benchmarks of education and training. So closer in your state, closer to you, you would get institution which reflects the highest standards of education. And likewise, the third point, they are also research institutions. They advance science and knowledge. And when they are spread like this, there is an opportunity for these institutions to advance research in areas which are geographically more important in that area rather than generic. It increases the base for creation of new knowledge and new solutions.
And sir, do you feel that digitization and Ayushman Bharat health accounts, ABHA, will help in ensuring that when a patient goes to AIIMS for treatment, the background of primary and secondary care they may have received earlier will be readily available and tertiary care will become easier and more effective?
The AIIMS family of institution should be at the forefront of digital health. They should encompass environment of a seamless system, which is as much as possible paperless. When you use digital systems, there is ease of operations, ease of access. And in that regard, ABHA, which is the Ayushman Bharat health account of an individual citizen, would be extremely useful, because what this account provides for is a platform on which the person's health details can be layered, can be stored, can be made available. And that happens when I'm moving from one facility, let's say at the primary care or secondary care, and I need to be referred to AIIMS, then I don't have to carry my reports, I don't have to carry my x-rays, and I move with my account and information loaded on that. With that, I report to AIIMS, and there, using the digital system, my doctor out there will be able to access all the information that she or he needs. That's the power of ABHA. Now, remember, when we are making a referral, it is still something which is in a way close in real time. It may be a few days. But remember, if you have a health record of the day today, and it is required 8 years from now, 10 years from now, then to be able to get all the paper records, all the details, all the x-rays, is not easy. But having ABHA would ensure that you have made these documents available on to these electronic records in electronic shape. The health records in electronic shape are loaded onto your ABHA system, and then they could be opened up 10 years from now, 30 years from now. This is the power of digital system that ABHA is. Because we are in the early stages of ABHA implementation, citizens must have your own ABHA ID and identity and number. That's one part. And then institutions like AIIMS should be the first one to start enabling citizens to have data on ABHA. Eventually, everybody else will also do this, the hospitals and the private sector and others. And then we move in the direction of a quick, easy to go about system of records, retrieval, usage, analysis, and so on and so forth going into future. So AIIMS have to take lead to make this happen, and that should happen today.
So yesterday, the Prime Minister also laid the foundation stone of and dedicated to the nation a total of 202 healthcare infrastructure projects worth more than rupees 11,700 crores across 23 states and UTs. And these include various facilities like critical care blocks, integrated public health laboratories, National Institutes of Naturopathy and Yoga, Virology Institutes, medical colleges, nursing colleges. How do you see this development, where the government is taking a whole of India approach and trying to reach out these facilities in every nook and corner of the country?
We should remember that these 10 years have been transformative for the health sector of India. We talked about the new AIIMS that have come up, with which we are now ending up with 22 new AIIMS across the nation. But the changes are not only in this sphere or in this particular conglomerate of projects. Look at the medical colleges. In the last 10 years, 157 new government medical colleges have been sanctioned. 98 of them are functional today. At these 157 medical colleges, nursing colleges will also be co-located. And not surprisingly, when you do work like this, and then other efforts are also coming in alignment, undergraduate seats from about 50,000 have become 110,000. Postgraduate specialty seats have risen from 32,000 to 70,000. Government medical colleges have more than doubled. Overall, medical colleges have moved from 380 to 706. Imagine, this is absolutely transformative when you look at the health infrastructure. Now, what the Honorable Prime Minister has done in Rajkot is operationalized and released and launched projects which are part of a very big mega scheme in particular, which is the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, the PMABM scheme, under which 50 units of critical care blocks have been launched. 15 integrated public health laboratories have been launched. 13 block public health units have been announced. And so much more of this has to come. The PMABM scheme is 60,000 crore scheme, and a lot of these facilities are those that have come under the PMABM scheme. Then there are additional projects that have been launched, including a 90-bedded multi-speciality unit in Jipmar, and so on, and another new medical college linked to Jipmar, Puducherry, at the cost of 491 crore. I want to emphasize that the size of these projects is huge. Take the example of the AIIMS that we were talking about. A typical AIIMS is a 900 to 1,000 to 1,100 crore project. That much amount of money has been made available to create health infrastructure, multifarious health infrastructure, including, of course, the high-end tertiary care institution that the AIIMS are.
Prime Minister also stated that the multiple foundation stone laying and inauguration projects taking place across the country, including the 5 AIIMS inaugurated yesterday, showcase a new tradition of getting work done at a faster pace. How important is this, that whatever is announced, the intent is turned into actual action and actual realization of the planned project?
The working style and the working paradigm of the Honorable Prime Minister, he envisages and envisions projects and initiatives that are of a scale, of a large scale. Then, also along with that, it is the speed of execution of the project. Scale and speed, both are the characteristics of the government.
I would like your comment on the Jan Aushadhi Kendras having expanded to more than 10,000 units across the country, which was mentioned by the PM. How important is this so that people from the economically weaker sections or middle class, they are able to afford health?
Well, Jan Aushadhi Kendras are a great innovation of our country. Today we have 10,000 Jan Aushadhi Kendras, and we expect this number to go to 25,000 in coming years very, very rapidly. Jan Aushadhi Kendras provide high quality medicines at a price which is half or even just 10% times of the cost in the market. And this becomes possible because a business model has been created through which the medicines are procured on scale. They are tested for their quality assurance, and then they are made available to the Jan Aushadhi Kendras, which are run by individuals, private individuals, on agreed standards and on agreed methodology. These centers are providing treatments which are of high quality, and they are saving a lot of money of the poor people that would go on to the drugs. And having an increasingly large network for Jan Aushadhis is a commitment of the government. And this is a unique way of helping to address the health conditions, providing treatment, but at the same time to save the expenses on the drugs on the part of the citizen. Therefore, affordable, high quality, life-saving, health-promoting medicines at affordable cost is the goal, and the speed with which this initiative is helping the people and the size is also remarkable.
Prime Minister also extended his best wishes to residents of all the cities where AIIMS were inaugurated. How important is, this point of view of the direct health benefits and the secondary benefits when an institution, as you said, like iconic institution like AIIMS comes up in any city?
The people of the region, of the area where new AIIMS are coming up are truly worthy of being congratulated on, because they are getting world-class institutions in their vicinity, institutions which will provide high quality, high-end care for sophisticated, complex diseases readily. It will save them their cost to go long distances. It is also something which they'll get soon without wasting time, without having to go far in terms of time. But also these would be the institutions where high-quality education and high-quality research would happen. AIIMS system also influences particularly the public health sector because you make connections. AIIMS would make connections with the district hospital, with the public health programs in that area, and it helps in improving the quality of public health delivery from the state governments and the state system. And also, in fact, it adds quality and adds intensity in specific ways through a collaboration between district hospitals and district health authorities. So it's a big thing for the local people. They get benefit which goes beyond just a hospital. Also, having a project of this size, large number of beds, 700 beds, and so on, is something which also provides jobs to the local community. Jobs that not only health professional jobs, but also additional jobs as staff. And also the local economy is benefited when you have such a big institution where clients are going, it's a public place, people are traveling, so it stimulates the local economy in multiple ways. So it's a win-win situation for the population of that district, that area, that region, those cities. Therefore, it is rightly a moment of celebration.
Dr. Paul, thank you so much for giving us a deeper insight into government's revolutionary initiatives for health infrastructure and research, thereby promoting accessibility and affordability in healthcare sector for all Indians. Thank you, sir.
You were listening to a discussion on inauguration of 5 new AIIMS promoting accessibility, affordability and research for health. The participants were Dr. V.K. Paul, member NITI AAYOG, and Sonu Sud, anchor. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official.
समाचार सेवा प्रभाग से प्रस्तुत है हमारा साप्ताहिक कार्यक्रम पब्लिक स्पीक।